The National Diabetes Prevention Program is a program that was developed by the Center for Disease Control and Prevention. And essentially it's an evidence-based lifestyle change program targeted at people with a condition known as prediabetes, essentially people who are at a significantly increased risk of developing type 2 diabetes. So the risk factors for diabetes include being a pre-diabetic, age greater than 45, being overweight, having a family history of type 2 diabetes, as well as having high blood pressure. Women who had diabetes develop transitionally through their pregnancy, called gestational diabetes, or women who have given birth to children 9 pounds or greater. All those risk factors increase your risk of ultimately developing type 2 diabetes. Most recent studies show that up to 1 out of 3 Americans actually has prediabetes. About 110 million people in the US that have prediabetes. The staggering numbers with that is that over 90% of the people with prediabetes don't actually know they have it. And the reason why that's significant is obviously if these folks don't know they have the condition, they're unlikely to be doing anything about it. And consequently, not doing anything about it puts them at increased risk of progressing to full diabetes. Almost 29 million Americans actually have diabetes. So the combination of the prediabetes and the diabetes clearly forms an extremely large population. People who enroll in this program can expect to work side by side with lifestyle coaches, essentially trained facilitators who will help them make better food choices, help encourage them to increase their physical activity, and ultimately learn the skills necessary to maintain those healthy food choices and maintain the weight loss.
What the program does is instead of becoming diabetic like they want to become healthy and not develop diabetes, which involves a change in their exercise, eating, and lifestyle. And this program goes over a 12-month period, and throughout that time we are giving folks information to help them with this decision making. We introduce the idea of exercise very early in the program and the importance of it. The thing is to get moving and finding a passion in an exercise that will work for you. We do everything we can to assist people to be on their own after this year. This ultimately is going to be a way to prevent diabetes, and it works.
I was 50 pounds heavier than what I am now, so I was considered obese, and it was affecting my health. I was tired all the time, no energies. With the program, I feel more healthy now. I feel more in power of my life and where I'm going, and I don't want to stop. It's fun. If I had a friend that just learned that they are pre-diabetic, I would tell them, don't hesitate, join the program. You have to do it for yourself. You have to be mentally and physically ready.
I've decided that I needed to have the diabetes prevention program because I was afraid for myself that I was going to become diabetic. The prevention program has helped me by changing the way I eat and my daily activities. I hadn't been in the gym in 25 years. And after getting involved in this program, I go to the gym 3 days a week. I've been running 5K marathons, and I'm more conscious as to what I've eaten. My activity level has increased. And I feel really good. I have a lot of energy. It's very beneficial. The support is amazing that's out there.
Through this program, I learned just to look at the labels. It was incredible the difference that made. Just changes my whole outlook on what's worth it to me to eat. I think I learned a lot through the program trying to make those type of informed choices. It made a big difference in how physically fit I feel. It's definitely been a plus in my life. I feel like I'm a much more energetic and positive person. Gradual changes over a lifetime is what it's all about. And this isn't a diet, this isn't a program, this isn't a one-time thing. This is my life now. It has to be just, something that you enjoy and want to continue and be healthy.
Some of the studies have indicated that a modest weight loss and continuing these lifestyle changes for at least 1 year and beyond can cause up to 58% reduction in progression to diabetes in people aged greater than 20. In the average person, it is largely preventable.